Hey there, I'm Daniel J. Gould, a board-certified plastic surgeon in Beverly Hills, and today I'm sharing a really special journey with you. One of my favorite patients and one of my favorite employees, Jasmine. She's a nurse in my office. She takes care of all my patients, and I've known her for almost 6 years. In fact, she was around when I was just starting up my practice in the very beginning and has taken care of my patients all that time. I first met her in an aftercare facility, and I knew right away that she was the right person and the right fit for my practice because she cares a lot about the patients, but she's also very attentive, very thoughtful, and she knows how to take a patient through the journey of plastic surgery. So she's sharing her experience with you today because she had surgery with me to improve the way that her face looks, her under eyes in particular, and to change a few other things. And she's going to share her experience. But I want to be sure to say this very important fact. People that work for me sometimes get surgery with me. They're not expected to share their journey. I'm really grateful that they do it. And they all are going to have a personal and unique and very special experience when it comes to their surgical journey with me. Just like any patient that would come to me, if you're seeking surgery, you don't have to share. It can be a personal experience with just me and you. It doesn't have to involve everyone else. But people who do share provide more information, more experience, more kind of education around the entire experience. That helps to open it up and to explain it better to you out there so that you know what to expect before, during, after the surgery. So we're going to dive into Jasmine's experience. A big thank you to her for sharing, and a big thank you to you for watching this so that you can get a better understanding, better knowledge of what you're about to go through. Also, another important concept, operating on Jasmine, who's one of my employees and a good friend, is no different than operating on any other patient that comes to my practice. I look at each patient as an individual. I learn about them, their needs, their desires, their family, their experience in life. I try to put that into the experience so that I can better serve them, better give them outcomes and results. Every person that comes to me, every patient that comes to me is an individual, and I treat them as if I would treat my own family and my own staff, just like Jasmine. So this experience was no different than how I would treat any patient coming from any walk of life for surgery for a good outcome. No one needs any of the surgeries that I do, and Jasmine certainly did not need surgery, but she came to me because she saw lower eye bags in her under eyes. And she said that as she kind of noticed in the last 2 to 3 years, they began a little bit worse and making her look a little bit tired, even though she's not tired. Genetically, she knew that she had a little bit of a bag there and wanted to address it at an early stage. And it's really been in the news a lot in the last 2 to 3 years, people coming for eyelid surgery to improve the look of their eyes. Now, keep in mind, this is not necessarily a beauty thing. It's really about the way that you look, giving a sense of being awake, alert, not tired, and not angry, not sad. The eyes portray a lot. They show that sense of vitality or looking awake. And she had noticed that her under eyes were bothering her. So we talked about what we could potentially do. She came to me and said, "Hey doctor, I think it's just about time for me to address these little lower eye bags." And I said, yeah, happy to do that. At the same time, we agreed to use a little bit of nano fat and structural fat to further improve her facial fat compartments, to improve the skin quality, and to do a little bit of a preventative maintenance on the underlying structure of her face. This is all done very carefully with, again, fat from her own body. So we're not utilizing products that can move or spread that have to have maintenance. We're really just using a tiny bit of fat from her own body to improve these things. She'd also had previous plastic surgery before and was relatively happy, but had a little scar in one area that she wanted to improve. Look, I'm not a magician. I'm a plastic surgeon, and I'm going to tell you this. It would be super easy for me to say, oh, I can fix scars and I can cure them. But the truth is she had already had a breast surgery that had gone through the early stages of tension. So although she had a scar, I kind of knew in the back of my mind, I can make it look better because the tension is gone now, the stretch is complete, and the skin is relaxed. So I told her, we can certainly go in there, remove the old scar, offload tension, use a few tricks in our practice, like new technologies that we use in order to offload tension on the scars, and give her the best looking possible incision. Because the truth is, everyone wants a great plastic surgery, a great outcome, a great shape to their body, but no one wants scars. And I frequently in my practice address secondary scars from other surgery or from my own surgeries to make them look as good as they can possibly look. So we decided to go forward with the surgical plan. The point of this video is to explain to you exactly what you may go through when you're having a surgical experience, but it's also to introduce you to someone who's very important in the practice and the process. Jasmine's a nurse who sees patients go through this every day, and she's been doing this for many years, so she's quite experienced in terms of plastic surgery. Sharing her own experience will hopefully educate you so that you can see what you're going to go through, but also you can learn a little bit more about my practice, learn about Jasmine, learn about how we approach healing and the process of surgery. The goal, again, is education. Education is how we prepare you for surgery. Knowledge is how we help to fight off anxiety and fear. And it's also how we get the best possible outcomes in the long run. A few common questions that patients have that had similar procedures to what Jasmine had. Number one, Why are we moving the fat from the lower bag into the cheek instead of just removing it? I like to transpose fat from the lower eyelid down into the cheek in cases where I want to add volume back in this transitional zone. I like moving the fat down into the cheek so it improves the contour from the lower eyelid to the cheek. If you just remove the fat, it can create a hollowness. You have to go back and fat graft, or you can fat graft at the same time. In certain cases, it's okay to remove fat instead of repositioning it. But in this case, in younger patients, it's generally better to reposition that fat, to move it down and transpose it down into the cheek. Number 2, what kind of fat are we using? Where does it come from? And is that important? I like to use fat from your own body in areas where the fat is physiologically dense. In the area around the love handle region, for instance, there's good physiologically dense fat, meaning it's hard to lose it when you lose weight and it doesn't change very much. But also there can be fat that we take from the medial knee or the medial thigh. These are regions that are high in stem cells. I like to mix the fats together and use the fat in different ways. One way that I use the fat is to harvest the fat and make it into something we call structural fat, which is living fat cells, stem cells, and growth factors. That adds structure or volume back to the face. That's going to go in the nasolabial fold, pregel sulcus, canine sulcus, the cheek, the temple, and the brow. I also sometimes use it in the ear and the earlobe to add back volume where it's lost. Sometimes it'll be in the submandibular sulcus in older patients if there's a little hollowing here, and oftentimes in the chin. And Jasmine liked her chin filler that she'd had before, wanted to augment the chin a bit further. So these are all targets that we utilized in her case. I will take that fat and process it into something we call nanofat. It's kind of a lie because it's not really fat. It's actually dead fat cells, stem cells, and growth factors. We process it and clear out the dead fat cells and utilize just the regenerative treatment, the stem cells and the growth factors to improve skin quality. That I microneedle in from top to bottom and inject it to the tear trough and the lips. It improves the blood flow to the skin in those areas. It makes the lip pinker, less vertical lines. It heals the lip, less crack, more moisture content. It makes the lower eyelid skin look better. Less dark, less crepey, less visible muscle between the skin and the outer or deeper layers. This is an important concept. Nanofat is a regenerative treatment, not a volume augmentation. It improves the skin quality in other ways. It is a peak regenerative treatment that I do in almost all my facial cases. In this way, we can take fat from your own body and use it to improve the shape of your face, but also to improve skin quality. Jasmine, just like other patients, wanted to know how long will this procedure last? Well, if you take the fat compartment in the lower eyelid and move it down to the cheek, it's not going to move back. You're not going to grow new fat. That's not going to grow unless you have one of the rare conditions that trigger fat growth around the eye. But generally speaking, one lower eyelid fat repositioning is enough for a lifetime. With regards to fat transfer, the amount of fat I can put in depends on how much is already there. This is an important key concept. Surgeons don't take time to explain this, and it often fails because if you have one fat cell, it needs another fat cell to give it oxygen, nutrient, and blood supply. So in a perfect world, the total amount of fat I can transfer into your face depends on what's already there. If you have this much, I can double it to this much. In a second surgery, I could go to this much. In a third surgery, this much. That means that if you're a thin patient with a thin face, the most fat I can transfer into it may be 20 cc's, and that may mean you want a second or third fat transfer procedure within the first 6 months to a year. I make patients wait around 6 to 9 months before secondary fat transfer because I want to make sure that what's there is stable and neovascularized so we're not overloading that system. After a fat transfer, at around 3 months, let's say the volume is consistent, that is what it is, that fat will maintain itself. But as you age, you will lose volume in your face. So I tell patients, if it looks like I knocked off 5 to 6 years, it's probably going to be another 5 to 6 years before you're back. And of course, if you age well, you take care of yourself, you're not losing a ton of weight, and you're taking care of the skin and skin quality, then that may last a little bit longer. The bottom line is if anyone can tell you how long it's gonna last, they're really lying to you because they don't know what your aging is gonna be like, how you're gonna age over time. But I would say in general, after a facelift procedure, most patients come back for secondary fat grafting around 5 to 8 years after the initial procedure. Again, a younger patient, like in Jasmine's case, may not be back for another 10 years because she's not likely to lose fat as easily or as frequently. Menopause affects this, weight loss affects this, medications that cause weight loss affect this. They're all part of the picture. Of course, if you lose weight, you may lose fat in your face and you may need a secondary procedure. This journey is shared with you to help you make decisions, informed decisions, because at the end of the day, we want you to come to the practice knowing what you want, but also understanding all the risks and all the benefits. Jasmine sharing her story and all the potential issues that could come up during surgery so that you're better informed. Our consult will be different. It will be tailored. It will be unique. It'll be you and me. It's not going to be Jasmine's experience. It's important to understand that each journey is unique. Yours will be no different.